Good afternoon to everyone present here. I cordially welcome you all to TechBharat 2021, Empowering EduTech and HealthTech. TechBharat is an initiative of Laghu Udyog Bharati, Karnataka and IMS Foundation. TechBharat is envisioned as a platform to support startups and SMEs and be a guiding light to them in navigating their journey. We welcome you to this session. Making healthcare innovative in its affordability and accessibility is the biggest challenge the world continues to face. This challenge is coupled with challenges in access to information and technology, improvement in healthcare policies, and reorganizing healthcare delivery systems to address basic aspects like cleanliness and hygiene in achieving universal health coverage. Further, through social entrepreneurship, access and traction to healthcare insurance, financing of healthcare services, building healthcare repositories, and adoption of innovative business models is essential. For this session, we have with us Dr. Shyam Vasudev Rao, who will be the moderator also. Dr. Shyam holds a doctorate in real-time embedded systems, specializing in parallel computer architecture from Indian Institute of Science, and has been with C.G. Smith, Ericsson, Tata Consultancy Services, and as a Director of Technology at Philips. He was instrumental in devising one of the first hardware-based antivirus solution in 90s. In his illustrious career, Dr. Shyam has established university relationships for joint research programs to work on wireless technology and medical electronics with IISc, IIT Mumbai, IIT Kharagpur, IIT Guwahati, and Aalborg University. A very warm welcome to you, sir, and we thank you for accepting our invitation to moderate this session.
Thank you.
We also have Dr. Satish, CEO and founder of Comofi Meditech with us. Comofi Medtech focuses on innovation and believes in providing healthcare solutions which improve health outcomes for patients, work efficiency, and safety for healthcare practitioners. We welcome you to this session, sir.
Thank you.
We have Dr. Akhtar Hussain, Dean, Yenapoya Dental College, with us today. Dr. Akhtar is the head of Department of Orthodontics and Dentofacial Orthopedics and Director of Craniofacial Anomalies at Yenapoya University, Mangalore. We thank you for accepting our invitation and welcome you, sir.
Welcome.
We have Mr. Mayush Shetty, co-founder and CEO, Black Frog Technologies. Black Frog Technologies is a product development and consultancy firm with a cross-functional approach combined with deep knowledge and industry expertise. They help clients build capabilities that they need for profitable growth. We welcome you to this session, sir. I now request Dr. Shyam Vasudev Rao to take over the session and moderate it. Over to you, sir.
Thank you, Gupta, and welcome to all of you again. And it's a wonderful opportunity for me to interact with these young minds. And the topic is what Mr. Gupta was saying. It is the affordability, accessibility, and digital health. All these actually converge into one. I'm sure we have all been seeing that in today's context. The WHO had published in 2011 the 4 A's, which basically talks about the managing the mismatch in a medical device or healthcare system in general. The 4 A's are basically affordability, the accessibility, the availability of the right type of equipment, right type of resources, doctors, all that, and the appropriateness, where we talk about what is the most appropriate technology for these things. So all these 4 A's are something which over a period of time we have been noticing in every segment of healthcare and life sciences. May it be pharma, may it be the healthcare, or may it be the operational efficiency and all that. So given that situation, we have also seen the contradictory things like, we have the electronic medical records, we have a whole lot of things around it, the information systems for almost every ology you talk about. But how much of it is in real practice? How much of it is really feasible? How much of it is being useful? These are the questions which I'm sure people like Dr. Akhtar and all would be facing every day. It is very difficult to ask a nurse or a doctor sitting in the consulting room to keep on entering all the values and data. And it is just a nightmare if you talk about one system. I populated the system with data. Now I migrate it to something. Then it is doing this data migration itself is a big challenge by itself. So like that, there are so many things which are a big challenge when we talk about this digitalization. It is like building a highway, and while you are building this highway, you are seeing that so many people are, in the places who are there on the way, on the highway, will face for several years, lot of constraints. But once this is all done, you will see that, things start moving very fast. Everything will start falling in place, right? So exactly like that, even in healthcare today, we are in that sort of a crossroad, and we see technologies are becoming very ripe, and they are all ready for usage. But then they need a whole lot of validations. They need a lot of acceptance. And once these things start falling in place, and then the numbers start growing, then we will see that whatever we have put now in the initial will start to pay off. Not only that it would pay off, we are going to also see a whole lot of things which will start lighting up. Like you start doing a lot of analytics, you start doing preventive maintenance, you start doing predictive maintenance, you start doing wellness management or disease management. All these, there's a whole bunch of things which will start coming on top of that. So given that situation, I think that India is now at the right opportunity to take off, and having this being the IT power hub for the world, we have the right position now to see if we can bring this cross domain engineers, doctors, the technicians, everyone together. We can now build this big the digital world in healthcare, and that could be a real big opportunity. And once we prove that here in India, this can be taken to the rest of the world. The whole world is waiting for it, and I'm sure we are at the right opportunistic moment. So this is something which I feel could be a dream, but I don't know. Each of you are much more experienced than me, and you might have your own insights. So I thought I pass this on to you people now. So if I say, Dr. Akhtar, what is that you feel about it?
First of all, let me thank you for getting me into this conversation. It's something that requires a lot of thoughts. As you said, the very positive note is that we are now the leaders actually in IT. So we should be the leaders for others. What I feel is that we definitely are in a new and rapidly changing global healthcare landscape where digital technologies are changing the rules of the game. So it's not about replacing the analog or paper process with digital ones. Now it's layering of technology on top of an existing work pattern. What I feel we need to understand is that the transformation comes from new ways of working, not the technology itself. Software does not define processes. Software automates process. This is what I'd like to put right at the beginning of it. I hope you agree with me. Simply
Okay.
put, simply put, transformation program where technology could best support it. Transformation is a program where the technology has to support it. It's about rethinking, re-engineering how work is done. Hence, what is crucial is a change in our culture and our mindset itself. It's a broad and a growing sector. It can cover anything from electronic records to wearable gadgets to mobile health apps to artificial intelligence enabled gadgets like the heart rate sensors, the exercise trackers, or sweat meters used to check the blood sugar in diabetes, oximeters, etc. can provide up-to-date monitoring of high-risk patients to warn in advance the likelihood of a major health event which can happen. Now, medical technologies like minimally invasive surgeries, better monitoring systems, more comfortable scanning equipments will allow better patient outcomes, reducing the human error and lowering risks, all made easier by the 5G mobile technologies that we have today. Augmented reality glasses would allow first responders to connect with faraway specialists, and robotic surgeries might allow surgeons to maybe work from home. We never know, reducing the contact with the patients and healthcare workers in cases required to be segregated. We do not know. So data sharing also is very interesting because it's got a lot of exciting future opportunities too. And anything can happen. 5G enabled drones would deliver life-saving medicines to devices to patients in hard to reach areas. So looking at the present scenario of stretched budgets with increasing aging populations in the country and rapidly growing prevalence of chronic illness, which are already exerting strain on the health systems, we have no choice but to capitalize on opportunities it offers. I see a glorious future in which the chaotic, disorganized, inefficient services of today are transformed into predictive, prognostic, and more synchronized and personal care. There is a lot to gain as the ingredients are now already in place to deliver more systematic, high quality care with real time patient monitoring and powerful analytics to deliver more proactive and targeted care, reducing costs and improving the outcomes. These are the main major things where I look at, but sadly, so far, we have not gone digital enough in the whole world to take advantages it offers compared to other sectors. I think it's about 7% compared to 13-14% in other car industries and others. So there's a lot more to happen. And this is, I feel, the opportunities. Of course, if we give a chance, let's also discuss about the challenges. Thank you.
Sure.
You want me to?
Very good. Very wonderfully said. I think this is there is a lot to do. There is a lot of digitization to do, and this is a segment which is really not that much touched as
Not that.
compared to the others. Like the airline industry, or you talk about the hotel industry, or you talk about the automobile industry.
Yes.
Such a lot of things have happened here. So with that, maybe we could see how this can be taken to the next one. So if I ask my friend Satish to enlighten us on his thoughts.
First of all, let me
Yeah.
thanks for this invitation. See, I agree. Obviously, it has entered in the digitization for the healthcare. From I will tell you our own perspective and how we really started. How do we use this? Our main focus has been actually to improve the work efficiencies for the surgeons in the hospital, or to improve the overall surgical outcomes. At the same time, I think we use the technologies to reduce the occupational health hazards in the operation theater while they are performing any intervention procedures. So being a healthcare robotics company, I think we leverage obviously the artificial intelligence or machine learning and mechatronics, robotics, even augmented reality, these sort of technologies to amalgamate it into a very nice platform, which essentially delivers. And basically our focus has been on to helping surgeons to do automate and perform some critical steps in a surgery. These are redefining steps which will improve the overall outcome. So this actually corroborates with some of the discussion points that we had just discussed in terms of lowering the treatment cost, say, for patients, or improving the error-free treatments or a patient outcome, or even doing a treatment planning. There has been a lot of focus earlier doing planning pre-surgeries, right? But now, because of the advancement of the technologies, at least we are moving towards doing intraoperative planning, right? The planning while the surgery is happening, right?
Yes.
So all that is happening. From a robotics point of view, I think we have seen, certainly 20 years ago, none of us would have thought, the internet-based or mobile-based applications, the progress that has happened. Inevitably, it will happen even on the surgery side as well. But because it is related to the patient health, it is related to life, generally the advancements, the acceptance in the healthcare is a little slower compared to, you would see it for any other applications that we have seen. However, I think we believe that if we solve for India, for a developing country, I think that application is definitely suitable for all developing as well as developed countries. We believe in building a robotic intervention platform or solutions using AI and AR, which will be affordable, which will be compact compared to existing very bulky robotic systems, right? Because that's what India needs, right? If I have to put some numbers, uh, outside, I mean, overall world, you would see anywhere from 6,000 to around 10,000 installations of these bigger robotic systems. In India, these are hardly 70 to 80 installations, right? The world is moving towards the robotic surgery, but even at this stage, we perform hardly 2 to 3% of the total surgeries are performed using robotics. So you see how much of the ground it has. The acceptance is coming, but because of the better technology, better imaging technology, better image analysis technologies, better image analysis in real time, all of this now helping us to solve those niche problems where we can help surgeons basically to better healthcare delivery. So that's been our focus, and that's where we use this technology, and we see that whole digitization, whole automation, or say automation is, it won't be that robot is doing surgery itself, but of course it's under the control of a surgeon. But end of the day, we are using these tools to improve the existing workflows, right? So I think that's where we see our focus is currently, and we see India is actually the best place to do this, because at every nook and corner you will see the different problem statements. The problem statement in the Western world may not fit directly for us, even in the healthcare, right? Because the sheer nature of problems, the scale of the problem is very different for us. So we believe, I think we, as being in India, I think we are rightly placed to utilize these emerging technologies, which will take us towards the digitization of healthcare.
Very, very nice. I think this is mobile has really revolutionized the whole thing. The whole world has got revolutionized, and so also our healthcare systems. Having said that, there are also the bigger challenges which will come to in the next round. But I see that robotics and these autonomous systems, I would say, are some sort of, if they are the future, because if the concept of now, instead of patient going to the hospital, can the hospital go to the patient? That is what is very important, because it is not possible for all the people to keep on traveling, coming to the bigger cities for a small little procedure or a consultation. That is something which with mobile technology we can really do a big job, and I think that is really picked up well, in some sense, on the hindsight, thanks to COVID, which has actually made the people realize the power of the simple tele consultation, telemedicine. So I think every problem leads to an opportunity, and that is a very good thing what we see today. And people don't want to now go to the consulting rooms, because just to go for a 5 minutes consultation and come with a infection, that's very bad. So they now start to switch over to this method. Otherwise, generally, it is not the doctors, I would say, who are reluctant to use it. It is the patients. They always feel, if I go and see the doctor, and the doctor touches me, I'll be fine. That is the sort of a belief system what we have in this country, and that I think took a lot of time to break. And today, because of the COVID or whatever, I think that has almost sort of broken. And this is leading a lot of opportunities to people like us now who can build on top of it. Okay, so with that, let me go to our friend Mayur, and Mayur, please can you share some of your thoughts on this the digitalization and the opportunities what we see today in front of us.
Yeah, certainly, sir. Thank you. Thank you, and thank you to the organizers at TechBharat for having me as well. So I think you made a very valid point with India being at the most appropriate place. Information technology has been a strong suit. So leveraging that, considering COVID or even otherwise, to solve some of the underlying healthcare problems. And I wholeheartedly agree with what Dr. Hussain mentioned about building on layers. Right? We can't disrupt for the sake of disrupting. The whole point of technology, and as somebody who's from technology background, I do believe that streamlining processes and protocols is what we should be looking at, and not completely overhauling systems. And in the current context, considering India is implementing the world's largest immunization program, I think I have a relevant example from the line of work that we are implementing. So just a bit of background on that. Back in 2017, we were funded by Government of India to develop a portable medical grade refrigeration system for last mile delivery of vaccines. So we've been implementing this in about 4 states in India right now. We're working with 2 other nations as well. So we've been manufacturing at small volumes, and we've been deploying this. This is a portable vaccine carrier that strictly maintains a 2 to 8 degrees Celsius transport, so that we can replace the archaic mode of vaccine transport, like using frozen ice packs or gel packs, which have been found to be very terrible because they drop temperatures below 0 degrees Celsius, and we know that both Covaxin and Covishield are freeze sensitive. So there's a heightened risk of administering inefficacious vaccines now. Just yesterday there was a case out of Assam where 1,000 doses were found to be frozen in the vaccine stockpile, which is absolutely terrible considering the resource constraint setup we're operating from. So this is something. This was a patented technology that we developed back in 2017, and we've been quite successful at developing it and implementing it. So this was more of a hardware solution, and as you rightly talked about, digital technology and improving logistical intelligence is what we've always been good at. Not just the Indian ecosystem, but our entire subcontinent has kind of focused on that over the last 20 years. And that's precisely what we did as well. We knew that we had this unique advantage of having a battery-powered system at the point of administering of vaccines, which means there's a lot of potential for incorporating a lot of other existing technology like 2D barcode scanners, NFC scanners on board our system, so that we can bring more traceability into the immunization supply chain. So currently we're building a platform where, moving ahead now, all of the vaccines are going to come with 2D barcodes on them. It's a silly example, but currently the shoes that you get on Amazon have more traceability than the vaccines you're getting, which is absolutely terrible, right? So moving ahead, we're going to get 2D barcode on each of the vaccine vials with data on the manufacturer, the batch number, the lot number, the expiry date. All of that is going to be on these QR codes. So, and on the other hand, Government of India is moving towards a unique health ID as well. Hopefully the Aadhaar program itself, because you have a unique identity, but they want to incorporate it into a immunization schedule. So we're working on a system. We're piloting it right now, where every time a vaccine is administered to an individual, you touch it to our device and you touch the health ID to our device, so that on a cloud level, there is handholding of who got which vaccine from which manufacturer, which batch, which lot. So in case there's an adverse effect arising from the vaccine itself, the pharmacovigilance team for the manufacturer has clear traceability of where his vaccines are going. And the patient is never at risk of getting, say, hepatitis A instead of hepatitis B vaccine, or an expired vaccine, or a recalled vaccine. And considering the demand for COVID vaccine, there's going to be a whole lot of black market activities as well. So no counterfeit vaccines are going to be passing through as well. So in this line, so the patient is also benefited, the manufacturers are benefited, even the primary health centers. Vaccines have the vaccine supply chain has a saying of just the right amount at the right time. So, this is just common knowledge for everybody that if you understock vaccines, you're not able to immunize enough number of people. But if you overstock, it's a huge problem, because power keeps going out. You're not maintaining cold chain, they go to waste. So maintaining that right inventory has always been a tricky issue. So this way you have exact data on the inventory and the movement of vaccines, how many doses, where are they going. Incorporating GPS facility into the last mile vaccine delivery is very helpful, because you can understand what areas are being immunized, who's being left out, what are the hotspots, who should we be prioritizing in immunization. So all of this data is what is going to be helping in decision making and getting ahead of this pandemic once and for all. So like you said, digitalization has a lot of these potential, which we can think of, which we can work together, but then end of the day, it's just about the entire ecosystem coming together and playing together. I mean, the scientific community has done its job. They've developed the vaccines. They've been tested. Now engineering is what is coming in to deliver the vaccines in the appropriate conditions. Next, it's going to be the data analytics and the AI guys who are going to figure out, who are going to map the data and figure out what we can do and how do we prevent or just push ahead the next pandemic. I mean, COVID-19 is hopefully going to get over in a couple of years, but what about the next one? There's always, I mean, this happens every once in 100 years, right? So how do we get ahead faster? This is definitely the fastest one in history, but how do we get ahead faster in the next one? So there's a lot of handholding between different players in the ecosystem. So I do believe from that standpoint, India is in the most appropriate state because we've got this experience of, I mean, universal immunization program has been deemed as one of the most successful public health interventions. So we have that experience. We're leveraging that experience of everybody from the doctors to healthcare workers, Anganwadi workers, ANMs. All of them are so aware of how safely we need to administer vaccines. So now I think this is these learnings that we've gotten over the last 10, 15 years have been helping us in get ahead of this pandemic. And I think this is going to put us in a position where we can be the leaders in kind of informing and guiding other countries, other emerging economies on how to get ahead of this pandemic. So yes, sir, I do believe we're in a very appropriate place. And this is like you said, I mean, while it's been terrible, it's also an opportunity for India to kind of position itself as a technology leader.
Excellent. See, this is a real good example of how digitization and also the modern technology can help in managing a unbelievable task. I would say almost unbelievable task, because imagine the vaccine programs which have been taking several hundreds of millions of dollars to make, and then one not just invent it but also validate it, and once it is validated, manufacture it. It would take anywhere between 7 to 10 years for anyone to come up with such a thing. But then you see the power of our hospitals and the bright minds and engineers. We are in a position to come up with a solution to it, and much more, in contemporary with others, big players. And we have already started the vaccination program. Just before this meeting, I had a call with Japanese guys on some other thing, and they're wondering, what did India do to get it so fast? So this is the thing. So what I mean to say is, this is the power where we say to get more from less. Okay. So this is something which my guru Dr. Mashalkar would call it as Gandhian innovation. And he said that, we need to do more from less and less for more. So if we have to do that, that is what is need of the hour today. You see that we need to adapt certain technologies like, frugal innovation and technologies to basically overcome these problems. And from that, if you see, now I have a real example of me talking about early detection, prevention, 15 years ago. And that is when I started this company called Forest Health, where we started to screen people at an early stage. It was very difficult. Why would somebody come and show their vitals and see, they just to get a one that, you may have a problem. See, there is a lot of reluctance from people to go for a screening, do early stage detection, prevention, and all that. But this COVID pandemic has taught another lesson. Those who were like that are penalized. See, those are the ones who are at a very high risk, and those who were healthy without having any of these comorbidities or things like immune system not in place, all that, they were the ones who were affected very highly. They got severe infections, and a lot of them lost their lives. So it is something which, is also taught people that the value of prevention, early detection and wellness. So with that, if you now put that back onto the scale and see now, we hardly have a small bunch of people or experts, super specialists to handle this healthcare problem. Now we are talking about the entire population needing some or the other sort of a support from these experts, maybe cardiologists or nephrologists or diabetologists or whoever, neurologists and all that. So it is almost an impossible task, which is without having automation, artificial intelligence, robotics, and all that. We will never be in a position to reach out to these people, to each and everyone in this situation. For example, nephrology, which I am working now, there are around 1,850 nephrologists in this country, and there are around 55 million people who are actually having chronic kidney disease. They are either in stage 1 or 2 or 3 or 4. And we have around 2.5 million people, 25 lakh people who need dialysis. And the whole country, we have an infrastructure to dialyze hardly a lakh of people. So you see, this is the type of challenges we have in front of us now. How are we going to bridge this challenge? So making the machine intelligent, that is what I have done with my machine. My dialysis machine is a smart dialysis machine. So while dialysis is happening, it is monitoring through IoT. It is monitoring the patient. And in case of any emergency, it's going to immediately stop the dialysis and raise alarm, not only on the machine, but also on the nephrologist's mobile, who has actually given the prescription. So that way. And then, having this entire thing connected, it is on the cloud. So we do a lot of data analytics on that. And then you can make the therapy more personalized. If a person is more compliant, and that person may come once in 3 days, that is okay for dialysis. Why should everyone come every alternate day and go through a 3.5, 4 hour session? So all these things can be personalized, and you can reduce the need for that much of resource and time and pain for the patient end user. So that is something, through digitization we can actually do it, and through this modern technology, connectivity, IoT, and all that, which could be achieved. So this is just one small example, but then there could be several other things to manage these challenges. So let me go back to Satish and see what he would see how we can manage the challenge.
Yes, sir. So I mean, so there is one or two examples I can give, right? So for example, the technology that at Comofi that we're building, right? Precisely that is, see, that saves around 15 to 30%, 35% of the surgery time. So again, when we say there is a burden on the healthcare, the skewed ratio of the patient versus the doctor, right? So the every minute that a doctor is spending in the hospital is important, right? So that has to go to the patient. So due to the improved work processes or use of the technology, if we are enabling saving of the time, right? So one of that is the using a platform like the intervention platform that we are developing saves around 15 to 35% of the time, right?
Exactly.
That is
operational efficiency. Yeah.
Operational. So again, at the same time, when we are saying it's the surgeon's time, that means there is associated stuff with that. There is operation theater time. All of that would be saved. So there is a better resource management, basically. Second is even so the particular case that we do currently we're looking at is for the kidney stones, right?
Yes.
So basically what happens, those who have kidney stones, the patients who goes through kidney stone surgery, 50% of those revisit the hospital in their lifetime just because of the reoccurrence of the stone, right? So essentially it is important to remove maximum percentage of the kidney stone in the first setting itself, right? And the key to that is to reaching inside the kidney itself, right? If you are able to do that, basically you are not, now see, indirectly it's going to also reduce the burden on the healthcare system if you are able to reduce the number of patients revisiting the hospital, right? Because you have a better system which is able to remove as much as kidney stone in the first setting itself, right? And if we have the minimal trauma to the patient, the amount of time or the amount of days, the number of days the patient is staying in the hospital will also reduce. So all these, there are additional benefits, add-on benefits of using these technologies, right? These cutting-edge technologies, I think, will help us to solve some of the challenges associated with the healthcare system and the delivery, basically the delivery of the healthcare system, and empowering the healthcare practitioners and the team. So that's what we focus on.
Yeah, perfect. So that is the thing, that this is a classical example of how you can get more from less. So by making it more and more operationally efficient and tweaking the workflows, and also doing the task shifting. Like if you see, there are some of the hospitals I have seen which are very, very efficient. Like for example, the Narayana Hridayalaya, or for example the Arvind Eye Hospital, where they have done the doctor is only the specialist is only looking at the patient only for that minimum amount of time what is needed. Rest is all done by counselors. So they have done the task shifting. Why should a doctor explain to the patient, oh, there are 4 different types of rooms, depending on your paying capacity, you can go to this one or that one. All these things are so common things. And if you see a patient, most of the time, they are more worried about their other aspects. Will I get vegetarian food here, non-vegetarian, all these, these are the things, and they don't care, whether it is a super specialist whom I'm talking, or whether I'm talking to a nurse or I'm talking to a hospital administrator. So if this whole thing is properly, the process is put in place, and the whole thing is sort of digitized, then that leads to a lot of optimization and more efficient way of using the resources, and that to these expensive resources. And that is where the digital transformation comes into play, because all this could only be achieved, it can only be achieved if there is a digital transformation done. So I know now, if the consultant is sitting in the room, he's a say retina specialist, and then he has another 8 or 10 people waiting outside, and he knows that who are the ones who are coming for the first time, who are the ones who are coming just for a checkup. He or she can start planning, on how I'm going to manage this queue. But just putting in that system, we could double the capacity of each consultant. That was the thing. We tried at Aravind, and we could do that. So that way, I think this is that is the power of digital transformation and digitization. So that is excellent, Satish. And let me go to our doctor friend Akhtar, and see how you feel about managing these opportunities and challenges.
Yes, I've been listening. Very interesting. Put very beautifully put. The thing I say is, in our country, one that we really count upon is, besides our strength, our government support, giving so much to innovations and things like that. I myself am in a benefactor. We started a medtech facility and incubation center. A lot of work is happening. That's one primary important thing. That's about the hardware. But the software I'm looking at is, we have another concept in India called as the Jugaad concept. We somehow put and make it happen. We don't look for the ideal situations, but we somehow, like, we could go to Mars, send the things to Mars in a much cheaper way than the more developed countries could do. That's because the Jugaad itself is coming into, into language now, that into a concept, into business management. That's, I think, is one of the areas where India has advantage over. And besides, what we need to do is actually a major teamwork between these people concerned. See, what happens, the doctors generally, they are only focused on their way of treatment, whatever we taught to them. We should make them think laterally, learn to think. Lateral thinking is very important. And the paradigm shift should be there in the doctors' minds, from just knowledge users to knowledge creators. They should cooperate and gel and talk with our counterparts in the engineering and other areas. And that's only when we can really come out very synergetically into these things. So I feel this paradigm shift and the teamwork and more emphasis on innovation and research, I think that's going to play a major role now.
Certainly, certainly. And it is also the education part, which is becoming more and more relevant now and more important. Every time you are making some change, you come up with a new protocol or you come up with a new procedure, then there is a need for us to propagate it across the community. So that e-learning, is something which is also a very fantastic tool, which comes so handy that with that, at a time, you can actually make, so many people aware of this new methodology. So e-learning is another very interesting thing, and it is going to become a bigger one for not only for CMEs and all that, also in terms of promoting newer products, newer technologies into the bigger fraternity in a very short time, because everybody can attend to these sort of things and they can opt whether they want to do it online and they want to do it offline or whatever. And the systems are basically built in such a way that they can evaluate and also certify them, give them some points, all those sort of things. And that is for a country like India, that is the most economical and best way of one. Otherwise, conducting regular conferences, seminars, CMEs in big places and all that, there are only hardly a few people who can attend. Not everyone can take the benefit of it. So e-learning is another aspect which also could be a very good part of our digital transformation and digitalization. So given these opportunities and situation what we are in, I think we are at the right opportunity to take off, is what I feel. And let us hear to Mayur what he feels about it.
Right, sir. I mean, at the risk of stating the obvious, technology has always been complementary to healthcare requirements. I mean, from the first time a scalpel was invented, a blade was sharpened and used in medical purpose, to the point of inventing X-rays or MRI scanners. It's been technology that's driving healthcare application. But I mean, MRI or X-rays, it's always been fundamental physics principles that have been leveraged for application in healthcare, right? And that's usually a slow process while fundamental sciences are translated into something that is usable on the ground for healthcare stuff. I think what's more important is to kind of identify, like my co-panel member just said, this is a little bit of a concern that healthcare workers, typically doctors do have a little bit of a tunnel vision when it comes to their work, where, I mean, you can't really blame them considering a resource-constrained country like India and with the kind of burden that they have on their own head. It's very difficult to kind of do your work and try to figure out how system efficiency can be improved. One interesting solution here is what I found from my alma mater. At Manipal University, they have a biomedical engineering department where the students spend about one semester just shadowing healthcare stuff. So they go to the hospitals and they identify where the gaps are and how we can plug in those gaps with technology. So this is very critical because you go out of your way and try to see what are some of the problems that are being overlooked and how technology can fit in. I mean, in a parallel line, about 4 years ago, we were working with the optometry department at Manipal University itself, and we were working on an ocular pressure estimators for a PhD candidate study. And it was a simple manometer that we had to design. And then when we asked the healthcare workers and the doctors, how would you prefer it, right? Like when there is an open-ended conversation of what would you want, first of all, because as engineers, we don't know what doctors want. I mean, that communication has to be there. It has to go both ways, right? And then the doctors actually said, we would prefer it if it's a wireless device, if it's just a headset, so that it can be used in a sleep study. You can just move it around and you can still identify the ocular pressure, right? And only then will we think of how can we solve it. While if the problem statement is not defined well enough, there is no way for biomedical engineering or embedded systems to solve problems. And I think in India, there's a little bit of gap that way, where the problem is here and the solution is being shot somewhere else. This hand-holding never happens, and that's the reason that that product market fit is also not there. I mean, India has one of the biggest problems, even with IITs and stuff, is that we have so many patents coming up every year, but all of them are shelved. They never see the market at the end of the day, right? It's because that product market fit is not there. So I think an open line of communication and incubators and I mean, government supporting innovations is like a very good, very strong first step in kind of ensuring that all of the ecosystem comes together and we tackle the problems in a comprehensive and holistic manner, right? I think that's very critical, sir.
The system, our whole body is a systemic biology, right? So if somebody gets a red eye, it may not be the problem of the eye itself. It may be the problem of so many things. They might have had a bad dinner or some good wine, or it might be that they are hypertensive, or it might be that they have got allergy for something, or it might be that some other organ is malfunctioning. They have some sort of a ion imbalance or whatever. So there is always this connect between the various organs. And that is the thing which, in today's world, now with this era of specialization, super specializations and all coming up, the cardiologist would only look at, the problem of the heart, but then all other organs also could lead to the problem of the heart, right? So there is a need, I think, for a digital a medical record. Until unless there is a medical record and also the information on the longitudinal on the previous visits or episodes, what has happened and all that, one will not be in a position to really come up with a very appropriate decision on what should be the treatment and the prognosis and all these sort of things, right? So from that point, it's getting all the more important that we make this big digital transformation to start using electronic medical records or building up the electronic medical records and use this information not just for the particular event or the episode, as it is called, or an encounter. It is used for a longer period of time, because today's world, the non-communicable diseases are the ones which are of a bigger problem than the communicable disease. I cannot say this loud now because, COVID has really made a big problem for all of us. But nevertheless, the infectious diseases are one-time things, or, you may get it once or twice or that sort of a thing. But non-communicable diseases are like, it's the rest of the life. Somebody getting diabetes, they have to manage it very carefully for the entire life. So that is the situation where we are. And when that is the case, there's a need for us to have these records. And then these records, there are so many standards and so many of these things. But today, with deriving this knowledge from the other walks of life, we can actually use this, as a storage thing. And you can actually use some of these fantastic platforms. Everyone, Microsoft has its own Arzu, and Amazon has its platform. Or there are so many solutions available today which offer you the best SLAs and also scalable to whatever level you want, without making even a small change in the code. So, and then linking it up with our UID, which is really a big boon when you talk about patient records and all that, because in India it is very difficult for us to go by somebody who would say his name and note it down, and then create a record for them or a paper version of it. Next time when the person comes, he may tell his name in a different way, and you might have to end up making one more this one for them. So that sort of a thing. So it is a difficult thing. So the UID really serves a lot of this purpose. And with Aadhaar, maybe if there is a way by which we could have everybody's health records, like a DigiLocker, have a health locker, which is already a recommendation in the from the government and the people who are doing the Aadhaar. So that way, it would be a very big boon I feel, to handle this situation and get the digitalization process much faster, because that is what is the need of the hour now. And we can really benefit from that, what do you say, the combination. And the opportunity is now really, available. And there may be a lot of flaws in the other systems, but definitely, there is a lot of them, they are, because it is linked with so many other benefits. Well, I think more than around 85-90% of the population, I believe, has an Aadhaar. So in India, so that way, you have a much bigger opportunity to, take on this with the Aadhaar and with this cloud platforms. So I think it has been a great learning from each of you. And on the closing remark, I would just request you to just voice out your thoughts, and that would be excellent, because this has been such a wonderful combination of different talents, different expertise. A doctor, you have a data scientist, you have engineers, you have robotics. All this, is really the building blocks of our new healthcare technology. So, do you want to some closing remarks from your side, Mayur?
Yeah, certainly, sir. I think your claim on digitizing being the need of the hour is kind of irrefutable. But I think we're on the right step that way. Ministry of Health and Family Welfare is stepped up its game in vaccine traceability itself. We're seeing it. From the very successful even portal that they have built, they've now built a COVID portal. They work very closely with the Ministry of Electronics and Telecommunication as well. So I think under Prime Minister Modi's leadership, we've done a fantastic job at ensuring that digital technologies reach the farthest corners and reach the masses. I mean, that vocal approach for endorsing new technology and entrepreneurship has been very critical, and I think it's working. So I'm glad that I'm in the right part of history, and I'm working on a line of work where it's I mean, the value is being recognized and we're supported wholeheartedly. I would say the last 4 years we've been completely supported by the government of India in every capacity, from regulatory affairs, from compliance, technology support, funding, all of it. So I'm very proud to be a part of this effort, and I see a very bright future for the country and the entire healthcare ecosystem, sir.
Great. Thank you. Mr. Satish.
Yes, sir. I guess clearly, I think India has started adopting these new technologies. We see that with respect to robotics, I think there is no more fear of unknown now, because we see this has been installed in many major cities and good number of hospitals. What we see is possibly is going forward is the the cost is something that I guess from a standpoint for India, I think that entrepreneurs from India, innovators, startups like us from India, I think we need to ensure that we deliver on it, because I think it's still a very cost-sensitive market, and there's nothing wrong in it. It's actually a good thing. But I think these technologies has to be used to reach to the expectations for the customers. While being a startup here in the ecosystem, I think it's been a great journey for us as well. I think these are cutting edge technologies, not easy to build alone, or neither in silos. So we had been fortunate. One is having good collaborations with hospitals. That is important, because these problem statements and everything has to come through the problem statement from the users, right? Those who see it day in, day out. So that's something is important for us when we are building this tech-enabled or digitalization, everything. I think it has to come from the market side, from the user side, that
Yes.
so that we end up actually having a very good established business need when we start implementing it. And I think for us, we have been very well supported from BIRAC and from DST, through Startup India, many other support that the government of India has established. So I think that is helping us to build these technologies, and these are at par anywhere in the world. And I think we should, as an ecosystem, continue to do so, and build these better technologies, better solutions for Indians and for the rest of the world. Yeah.
Yes, very, very, very appropriate. I think this is something which, again, going back to the COVID days, not that it's over, we saw that, when the beginning of this COVID, the biggest problem what everybody envisaged was that the need for ventilators. Okay, later on
Yes.
it got disappeared. But at that time, the whole world, wanted ventilators. And in India, the companies like Philips and Siemens and GEs and all that, they said, well, we can give you 200 ventilators max, 100 ventilators. Because see, the cost, as you rightly said, you see, in India, the same equipment, will have to be sold at a very low cost compared to the other part of the world. So from that point, and then BL could make the ventilators by taking a technology transfer from a local company. And today, they have flooded the whole market with 30,000 ventilators. And then that way, we can rise up to the occasion and also see how we can actually do the. So that's amazing. And so, any remarks from your side before we wind up, Dr. Akhtar?
Nothing. It's like I just like to touch upon one of the fears that most of us have. That is about data security and hacking. So this is one of the
Yes.
fears, one of the negative things that I think we need to touch upon a little bit about it. And
Yes.
for this, we require a strong, data governance and security, particularly in the face of growing threats from the cyber attacks. And I'm very optimistic personally in stating that the technology will soon play an instrumental role in keeping our electronic health records accurate and safe. Records are not only 100% accurate, but also harder to hack now, because the blockchain electronic health records improves the transparency and integrity through full visibility through the digital ledger. So, and even the conflict information is automatically detected and things like that. So the one the more bigger challenge would be, I think, organizing the data and crunch the data to identify areas of weakness and better understand the market. As I feel, as we touched upon, of course, risk is there in anything that we do new. Hazards can arise from software problems, interoperability between systems, and poor network performances can also lead to dangerous situations, and could even create a domino effect where one component of system can affect the operation of the another. So all these things are there, but let's be optimistic. Let's look forward. We have a good government supporting all these things, make in India, and supporting so much to do innovations in technology. I think I see a very bright future for India, not for India, but for the whole world. Thank you.
So thank you, Dr. Mayur and Satish, for the wonderful opportunity to interact and share our thoughts.
Thank you, sir.
Now I pass it on to our friend Gupta.
Thank you, Dr.
Thank
Sham.
you.
Thank you, dear panelists. I think it was a very interesting panel discussion, some very interesting perspectives shared. And I think we share one common thought: digital transformation is inevitable. There are some issues, concerns, challenges, but I think we'll soon figure out how to overcome that. Thank you, dear panelists, for accepting our invitation to be part of this panel discussion. We wish you the very best. Thank you, and have a nice day.
Thank
Good
you. Bye
Thank
bye.
you.
Bye.
Bye-bye.
Thank
Take
you.
care.
Thank you.
God bless.